Hello there. We're going to be looking at the best way to start your OET speaking roleplay in this lesson. If you remember, in the OET speaking, you'll get two role plays to work through with the interlocutor. Each scenario will be different, so it's the same interlocutor who'll be playing the part of two different patients or carers with different health situations. So, how should you start your actual role play? And in fact, does it actually matter how you begin? Well, I can answer that straight away. Yes, of course, it does matter how you begin. And the reason is that it's actually one of the criteria that the examiners will be looking for. So, if we look here in the indicators of relationship building, they are looking to see if you can initiate the interaction appropriately, and this includes greetings, introductions, and explaining the nature of the interview. So, if that's what the examiners want, then that's what you have to give them. And we're going to look at exactly how you can do this in this lesson. Thank you for joining me today. My name's Sona. I'm your online OET tutor with Bose Learning, and I'm a premium preparation provider of the OET. So then, let's start. In the test, don't forget, you get 3 minutes to prepare the actual role play. And in that time, it's so important that you make a note of how you're going to begin, because that gives you peace of mind and you also know that you are hitting that criteria. And the way you can make sure that you're fulfilling the brief is by doing the following things. I'm going to go over three of these tips right now. So, the first thing to do is to look at the setting. So, they give you the setting, don't ignore it. It's really, really important that you understand whether the role play that you're going to be doing is set in a routine kind of situation, a clinic, or something like that, or if it's an emergency situation. And of course, there's a difference, so you'd have to start your role play differently. We'll look at that in a moment. Also, check if you know the patient already, because of course that affects the way you begin. And it's a really good idea to start each role play differently, if you can, to demonstrate your skills, that you know how to adapt your style according to the situation in hand. So, we're going to be looking at the beginnings, just the beginnings of 4 role plays. This is suitable for all professions, so it doesn't really matter what profession you happen to be, a nurse, a doctor, physiotherapist, etc. etc. We're going to be covering the basics of how to begin for all of you. And as I say, we're going to be looking at 4 different scenarios taken from the OET website. I've always put the URL down here, and I'm going to put them in the information box as well, so you can check these out in your own time. As I say, we're just going to be looking at the very, very beginning. So the setting, your background information, and then maybe the first task if appropriate. So in this case, what you'll notice is that the setting is a medical clinic, and you happen to be a doctor in this one. As I say, if you're a nurse, etc., don't worry, stay tuned, because this applies to you, whatever your profession is. And it tells you you see an 86-year-old patient who has limited mobility. You see an 86-year-old patient. Okay, look at the difference between role play number 2, which we'll come on to in a moment, which again is in a clinic. Okay, medical clinic. This time you're a nurse. And this time it says your patient is 51 years old. Your patient. So you can see here it tells you quite clearly whether you know the patient or not. Because in this case, it's just an 86-year-old patient. And in this case, it happens to be your very own patient. So you obviously know them. We'll come back to this in a moment. Let's just focus on this one for the moment. So as I say, here is the setting, medical clinic. You see an 86-year-old patient who has limited mobility. He or she because we don't know who the interlocutor happens to be. It could be a man, could be a woman. Respond appropriately, uses a walking frame, and attends regular chair exercise classes. He or she has come to see you about discomfort in his or her lower back. So it's a bit of a mouthful to read, but don't be put off by his, her. It really just depends on the gender of the interlocutor in question. They give you your suspicions as well: mild back strain. This is your kind of diagnosis, which you come to during the task itself. So this is just background information at the moment. So if we remember, one of the indicators of good relationship building is being able to introduce yourself correctly. How can you do that? In this case, remember, it's an 86-year-old patient. So they probably don't know you. So you are very much in your rights. It's very natural to introduce yourself. And you could say something like, hello, and give your name, and then go on to explain your role. I'm one of the doctors here. I'm one of the physiotherapists here, whatever your role happens to be. So greet the patient, give them your name, and then your job description so they know exactly who they are dealing with. What about their name? How do you find that out? Well, because you don't know them, you could ask them to confirm. Could you just confirm your name, please? Again, that's very, very natural. It's very normal. You're checking to see that you've got the right patient in front of you as the patient notes that you have. And that would be very typical in a healthcare setting anyway. So you can ask them to confirm their name, and then you can check with them, how should I address you? Or what name should I call you? And they might say Mr. or Mrs. so and so, such and such, whatever their name happens to be. Or they might say, oh, you can call me by my first name, which is Peter, or Penelope, or whatever it happens to be. So you can also ask them what their name is. So that's one way of checking their name. There are other ways as well, which I go into in a bit more detail in my Udemy course, so I won't bore you with that now. But these are just some ideas for you. Now, the next thing to think about is explaining the nature of the interview. In your notes, it tells you that he or she has come to see you about discomfort in their lower back. But because it's the first time you've seen this patient, you don't know them, you can ask them, how can I help? Perfectly normal, perfectly fine. Just come out with it. How can I help? Okay, let's have a look at another scenario together. So if you remember, this again was in a clinic. This time it's a nurse, and this time it happens to be your patient that you're seeing. So you know them. This patient is 51, has had a lesion removed from his or her hand following the diagnosis of carcinoma. And he or she was overexposed rather, to the sun in their teens. You've come to remove the stitches. So the task carries on, of course, and goes into this in more detail. But your job is to remove the patient's stitches, basically. So, because it's your patient, it would make absolutely no sense to say, hello, my name is blah, 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 because they know you. There's no point asking them or telling them rather what your job is. They know you already. They know you're the nurse. They know your name. So don't say that. Just begin in a different way. Why not just say, how are you, Mrs. M. Rudula? You can invent a name. If you want, no harm in that. Or you could even ask the interlocutor at the beginning in your 3 minutes what their name is, and you can use that. So just go with something and just carry on with it. So just begin by, hi, how are you, Mrs.? And then pick a name, or use the interlocutor's name if you prefer. What about the nature of the interview? Again, you know the patient, you've seen them before, so there's no point in saying, "How can I help?" Instead, why not refer to your notes? So I can see from my notes that it's time to remove your stitches. So you can go straight into this and refer to the notes and explain the nature of the interview that way. And confirm the reason that's actually the first task here. So I'll do that if that's okay, and then I'll clean the wound and dress the wound and just check, does that sound okay? And then, of course, you can go on to ask them if they have any concerns. Does that sound okay? All right, so that's some more ideas for you. Let's have a look at a third scenario together. This time, the setting is very different. It's an emergency department. The parent presented 2 hours ago with his or her 4-year-old son, so you can imagine the panic. The child had a 36-hour history of recurrent vomiting and stomach pain, which was diagnosed as viral gastroenteritis. So we know that it's a boy, the child, was given oral rehydration fluids and observed for 2 hours. The little boy is now ready to be discharged, and the child is not present for your discussion with the parent. You'll never be talking to a child or anything, a baby, something like that. It will always just be the parent or the carer alone. Okay, so how do you begin this time? Would you say, "Hello, my name is, I'm the doctor or the nurse on duty today. How can I help?" Well, you could do, I suppose. It's a way to begin. But is it really appropriate to begin like this with a parent who's obviously super stressed, super tired? They've obviously been up with the kid, 36 hours with this bug. They've come to the emergency department in a really stressed way. It's not a very nice place to be. I'm sure you can all appreciate that. So, what would be a nicer way to start? You obviously haven't seen the child before either. So, instead of beginning like that, maybe choose a different approach and say, "Hello, I'm very sorry for the wait earlier. We've been really busy today and I haven't had a chance to pop by. But I know you've been in good hands and your son is in good hands. So I haven't personally seen you yet, but I know you're in the best place that you could be and your son was getting the best care." Then you can tell them who you are. "My name is Dr. Danada, and I'm the doctor on duty today." It would be very natural to say, "How is your son doing now?" And hopefully that will continue on the role play. So just be as natural as you can, be as empathetic as you can as well. Think about how the parent or carer or patient is actually feeling at the time. In this case, the first task was confirm that the child is ready to be discharged and find out about any concerns. So, as I say, in this case, the first task was to confirm that the son is ready to be discharged and to find out if the parent has any concerns. So, how do you do that? You could say, "So, the good news is," every parent wants good news, right? About their little boy who's sick or little girl who's sick. So, the good news is we've given your little boy, remember we know it's a boy, the rehydration fluids because he was a bit dehydrated from the bug he had. We're using less formal language, of course, and he's doing really well because you've observed him or somebody's observed him for 2 hours. So he's ready to go home. Discharged, he's ready to go home. But before we discharge him, I wanted to check if you had any questions. Okay, so give them the good news and then find out if they have any questions, which is the nature of the interview, which is why you're actually having this consultation right now. Okay, so again, just really be sensitive and think about the situation. And then let's do one more together. So this is a different scenario again. It's a community health centre in this case. It's the nurse, and you see an 18-year-old patient, so you don't know them, who is in his or her last year of high school. He or she is worried about an approaching examination and is having panic attacks. He or she is seeing you for advice on how to manage them. Okay. So again, be sympathetic. Think about how you can approach this one. How would you begin? So you don't know the patient. So you can start by saying something like, "Hello, it's Peter, isn't it?" Or it's again, ask the interlocutor's name or what's the patient's name, or make one up. Hi, it's Fanula, isn't it? Nice to meet you. I'm blah blah blah. I'm one of the nurses or doctors or whoever you happen to be here at the clinic. So start in a slightly different way. Be more encouraging, maybe. Um, the nature of the interview, you could just say, "How can I help you today?" Again, perfectly fine. Or if you want to try and start in a different way, you can say, "I hear that it's nearly exam time coming up and you're having some worries about that. Can you tell me more about it?" So you're referring to the notes and then you're still asking that nice open question to get the patient to tell you the reason for the consultation in their own words. Okay, so there are some ideas for you. So to summarise, what's the best way to start the role play? Well, the best way is to adapt it according to the scenario in front of you. Read and understand the setting. Think about whether you need to introduce yourself or confirm the patient's name. Maybe you do, maybe you don't. And think about the best way to talk about the nature of the interview. You could just ask the patient, or you could get them to confirm and explain more. Overall, be sympathetic, be empathetic, and be really aware of who you're talking to and where this happens to take place, and that will set you off in a good direction. Well then, I hope that's given you some ideas. Thanks very much for watching. As I say, if you do want more information, then why not check out my on-demand pre-recorded courses. These are available on Udemy, and what I'll do is put in some discount codes in the info box below as well. And if you like this, I'd be so happy if you could help me to grow this channel. So all you need to do is press that like button, subscribe would be fabulous, and send this to a friend or a colleague who you think might like it. And that would really help grow this channel and help more people watch more videos like this for free and hopefully improve their OET and upgrade their skills. So thanks again for watching. Oh, one more thing to tell you. Why not sign up for a free dose of all things OET? That's my regular newsletter and Telegram group. So just scan that QR code and it should take you to a nice link where you can put in your information. So once more, thanks very much for watching and hopefully see you again sometime soon. Take care. Bye bye.